Let's start our county road trip in Laikipia, where access to healthcare systems in the remote area of Kurum, that is in Laikipia North, has been a challenge to the residents who have often had to walk for over 15 kilometers to the nearest health facility in the faraway town of Doldol. Now, this has been especially difficult for expectant mothers who more often opt to deliver at home without medical attention. And as KTN's Karum now reports, the situation in Kurum is about to change.
Imagine this. Labor pains have set in and the nearest health facility is over 15 kilometers away, yet there are no vehicles too, as the roads are practically impassable. The situation is complicated further at night when there are no borders for hire. This is the situation that many women in Kurum area of Laikipia North have found themselves in. Take Selina Mpomoki for instance. Mpomoki delivered her children at home. When her labor pains began, it was on a rainy night and there was no way to get to Doldol from Kurum, forcing her to give birth at home.
Mimi kusalia nyumbani ilikuwa imenyesha na ilikuwa usiku, so fenye sasa ilikuwa inatafuta means kwa sababu tuko na ambulance moja tu ile ya Doldol, so lazima apigiwe simu, maybe anaweza sema dereva yuko, lakini siku hiyo ilikuwa imenyesha, so kabla ikifanya hiyo process nimekaribia kujifungua.
Because this is the only dispensary in Morupusi group branch. A population of about over 8,000 is being served by this health facility.
The completion of a new clinic in Kurum is expected to bring good tidings to the residents of this locality who have had no access to healthcare. The Kurum dispensary, though yet to start offering delivery services, has so far brought relief to many. Oledepe Kilwa has arrived on a border to bring his ailing son to the clinic. Kurum Clinic, that has been built by funds from the Australian government, has saved Oledepe a long trip to Doldol, where you'd have had to take his son.
Natembea kama kilometers 12 na mguu.
This newly established clinic is like a breath of fresh air for the residents who can now access medical services, and the best news is that they can do so at no fee. Douglas Sagini is in charge of the Kurum dispensary. He is a nurse by profession and the only attendant here. There is no fridge yet to store some vital drugs, but the installation of solar energy will soon see the transformation of health service delivery. Another challenge is that there is no ambulance to ferry the critically ill, but Sagini is hopeful that this will soon change.
The common conditions that I normally in Kadiri is upper respiratory conditions mostly, and then pneumonia in the children. Malaria, very few cases.
The Australian High Commissioner to Kenya, Geoff Tooth, who visited the dispensary together with the Laikipia Governor Joshua Irungu, pledged Australia's commitment to improving healthcare in marginalized areas.
This is going to be the start of, hopefully, a project that covers the whole of Laikipia County. You will be leading the way. You, this community, and the other communities involved in the start of this project will be showing what can be done.
Kazi tumeyafanya. Mkiangalia mabarabara na kazi zingine, madawa za hospitali tumeyafanya na tutaendelea na kufanya. Ukiona maji inaletwa na gari hapa, hiyo ni kazi yote tunayafanya kama county government.
Kurum Clinic serves a population of about 8,000 people at Mulupusi, Kurum and its environs. Karum Laikipia, Kurum, Laikipia North.